Hi, my name's Sarah. I'm an addictions counsellor here at Hope Rehab in Thailand, and today I would like to talk to you about relationships in early recovery and relationships in treatment and the dangers of. So coming into a treatment centre, it means you've identified that you want help, which is great. It's the most bravest thing that any person I feel can do. So well done for that. Coming into treatment out of addiction, you are a vulnerable person. You are coming because there are pieces of your life that may be missing, that you maybe can't deal with life on life's terms, and you are struggling with day-to-day life. So well done for getting yourself into treatment and asking for the help that you so rightly deserve. When you come into treatment, normally as a vulnerable adult, that comes with, emotions that may have not been expressed for some time, feelings that you don't know how to express, and it can be a very, very emotional and confusing time to begin with. So whilst in that confusion of what is my life going to be like, what am I going to do here, all the very normal thoughts and reasonings that we go through as to why I am in treatment, normally what we would do from that is we would use drugs. We would drink alcohol. We would do something to suppress those feelings because that is our coping mechanism. That is what we do to cope with life. That is what you do to cope with life on life's terms. So it's very, very common for men and women to start looking for other things external of themselves to fix that feeling. And in treatment, you don't have access to drugs and alcohol, so therefore, it's very, very common for you to start fixing on people. So romantic relationships are blossomed in treatment quite regularly simply because you don't have access to your normal and usual way of suppressing those feelings. These are where romantic relationships are blossomed, and this is highly, highly dangerous for the individual in treatment. So this is a chance for you as an individual to grow, to learn, to process, and to get out any of that stuff that you've been carrying around probably for many, many years, and which you have used drugs off, which you have tried to suppress. This is an opportunity for you to learn and grow in this area, and I would really strongly recommend that you use it wisely. By getting into a romantic relationship, it actually lights up the same part of the brain as when you are using drugs or alcohol. It's exactly the same receptor, it's the same reward center in the brain. So you are fixing your feelings, so therefore you are still really using drugs through people. The chances of relapse is tripled once getting into a relationship whilst you're in treatment, simply because of the reward center. You are not focusing on treatment. You're not focusing on the real reason why you have come to treatment. You actually start to focus on the other person because they are fixing those feelings. So they become your new drug. This is really, really important. What if to say this other person was to relapse? What if to say that this other person was to abscond from treatment? How would you be left feeling? How would you be left in more pain, which you'd want to suppress even more? And now you have nothing else to suppress those feelings, so therefore it is heightened where you may abscond from rehab yourself and you may relapse. Your ability to make good, sound choices is compromised once you get into a romantic relationship because the focus isn't on you. Recovery is about self-discovery. It's a journey of this amazing, amazing self-discovery that you have access to if you concentrate on yourself. So it is recommended not to get into a relationship for the first year of your recovery, and there's a reason for that, because you're going to learn skills, you're going to learn tools, you're going to learn how to self-regulate emotions and feelings. You're going to be going to meetings, making new connections. You're going to start to develop social skills for the right reasons this time. So if you don't know how to practice all that already, and you're not giving yourself a chance for the first years in your recovery, then what chance have you of survival in your recovery? Because this person, this relationship, is only a deterrent away from actually what the problem is, and that lies within. Also, getting into relationships in recovery can also be an avoidance of self. So people like to take care of other people in order to avoid what's actually going on for them. So if I just look after this person over here, then I don't have to look at actually what's going on for me. And I really do acknowledge how scary it is to feel feelings. I acknowledge how scary it is to express feelings, fear of trust, fear of being judged, all the fear that surrounds you feeling and expressing for the first time in probably a long time. I acknowledge that. However, that is highly, highly important for you to learn to do that in order for you to have a successful recovery and not avoid with other people. You come first in your recovery. So be careful. Try not to use other people's vulnerabilities to fix your feelings, and don't allow somebody to fix off your vulnerability either. Remember, you're here for you. You come first in your recovery. You have to put yourself first for the right reasons, probably for the first time in a long time. So please, if you're thinking about getting into a relationship in recovery very early on or in treatment, remember why you're here. Remember that it starts with you. My name's Sarah. Thanks for listening. Take care.